All right, we have action. Good afternoon, Facebook and District 73 and beyond. My name is Kim McCarthy. I'm running to be the next state representative in District 73 here in Greene County. That district covers the cities of Beavercreek, Bellbrook, Fairborn, and Yellow Springs, as well as the townships that surround those cities. I come here every Friday for my Front Porch Friday. I'm out here today. I thought it was going to be cooler, but it's deceiving. It looked cooler from inside. It's just humid. Welcome to Ohio, huh? But I come out here every Friday to share not just who I am and what I stand for, so that you can make a good decision in November about who you want to be your next state representative, but also to discuss the issues that we face, the issues you care about. If you have suggestions on issues you'd like me to cover, I encourage you to reach out to me and I will see what I can do. So far, we've been covering a whole range of different things that affect our communities. And frankly, I've enjoyed it immensely, and the feedback that I've received from others show me that you do too. So I'm hoping to continue that. Today, we're going to be having a resident of District 73. Her name is Kathryn Hitchcock. She is the Director of Outreach and Development for NAMI, which stands for the National Alliance on Mental Illness. So, you know, mental health is a huge problem for most of us. I think it's 1 in 5 people are affected by it. But when you include things like anxiety and depression in that category, you know, that makes it a much higher number. I know I've suffered from both of those things at certain times in my life, for sure. And it's something we don't want to shy away from speaking about. So the more we talk about it, the more accepted it is, the more help we can get to make us feel human, the more we can contribute to our society, the more healthier our society will be. And well, that's a win for everyone, right? So Kathryn will be coming on in a moment, but I want to just do my campaign summary before we begin. So I was on a podcast this week with some women from Northwest Ohio called Girl, We've Got Issues, which I think is a hilarious name for a podcast. It's a podcast for women and politics. So that was really fun. You can find that link on my Facebook page. But like and follow their podcast too. You'll find them online as well. So the big thing this week, I guess, it just came out yesterday. My campaign's continuing to go along great. We continuing to receive donations and support from people, which is really important. Boomer, come up here, baby. Come on, come up here now. Come up and say hi. Come over here. He's camera shy. He's like, I'm staying down there where you don't bother me. Let me do this. Hey, Boomer. Boomer, say hi. That's Boomer. Anyway, yesterday, the Secretary of State charged Larry Householder and the other associated entities with 162 campaign finance violations. Eek! Not only are they under a federal indictment, now the Secretary of State is coming after them. So I'm going to pull up my little board that I used in my corruption video a number of weeks back, but the campaign contributions that my opponent, Brian Lampton, got, these people, these contributions are included in these 162 violations. Campaign management by Constant Content, that company and its owner, the money that they received are included in those campaign contributions, campaign violations, I should say. And then lastly, the dark money PAC, growth and opportunity PAC, was included and is named in these campaign finance violations. More evidence that Brian Lampton was an ally of Householder and benefited personally and professionally, I guess if you call this his profession, from that involvement. This is not a person that we need to have representing us. We can give him the benefit of the doubt and say he had no idea what was going on. People were just throwing money at him and he had no idea. Well, you know what? We don't need someone with that kind of naivety, that kind of lack of understanding of how politics works. You know, people don't just give you large sums of money like that and not ask for anything in return. That's why I have pledged to not accept corporate PAC money. I would never have taken that kind of money. So anyway, that's the big issue for the week. So again, nothing from Lambton, no comments, no policy platforms, nothing happening on his Facebook page. No explaining the bad judgment he has, nothing. One other thing, ODP, I saw yesterday, named me as one of 6 candidates who are considered to be in an emerging district. That means that we have stepped up to run in a gerrymandered district. And that's what's happened, right? This is my 2nd year in a row doing it. So they go on to say that our voices are critical to holding Republicans accountable and elevating the Ohio Promise message to voters across the state. And you know what? That's what I do. I thrive on doing that. We have to hold these elected officials accountable. I've been doing it for years now, and now I'm doing it from this position as a candidate. So happy to receive that designation and happy to keep Greene County emerging through the sea of red that has left us behind. We need more progressive values. We need to invest in people. We need to stop concentrating on these issues that don't really matter to us. So one last thing, we do have our postcards in. If you'd like to write postcards for the campaign, you can send me a message on Facebook, or you can email vote@kimmccarthyoh.com, and we can set you up with a pack of 50 postcards. Might take you an hour and a half. So write the address on and a short note as to why you're voting for me, and put them in the mailbox, and that's it. Easy peasy. So, all right, that's my update for this morning, or I guess it's afternoon now. So I'm going to bring in Kathryn Hitchcock so that she can join the conversation. Good afternoon, Kathryn. Welcome.
Thank you.
Welcome to my front porch.
I love your front porch.
And I just introduced Boomer's up here now, but he didn't want to come over and sit close to me. But there's Boomer joining us for the conversation.
I totally understand.
All right, so I wanted to start off our conversation by playing a video that you had sent me. So let me just locate that. I probably should have got it up earlier, but let's have a look here. Won't take me a moment. Like I said earlier, Kathryn is the Director of Outreach and Development for NAMI for Clark, Greene, and Madison counties. So, all right, here we go. All right, let me hit pause and let me screen share.
This is a little video produced by our National NAMI office in their effort to vote for mental health. That's the campaign.
All right. All right, here it is. Can you hear that?
Don't hear the video.
Okay, hold on. All right, let me just stop that and start again because I know what I did wrong. Sorry. I have to click the share computer sound button. There we go.
I applaud you for your courage.
I've been doing this a little bit lately. All right, let's try that.
The polls, you have many choices to make.
Can you hear that now?
Impact you, the people you care about, those in your neighborhood, and across the country. Your vote also has the power to help people with mental illness. But with so many issues taking front and center on Election Day, mental health often gets lost in the noise. What if we told you you're already voting on mental health? When you vote on the economy, you should consider the local grocery store manager living with bipolar disorder. Mental illness costs the U.S. economy billions in lost earnings every year. Treatment and employment services help people with mental illness get work and stay in fulfilling jobs. When you vote for education, your vote affects the teenager thinking about suicide. Policymakers influence how our schools provide help and resources for students experiencing mental health conditions. A vote for health care impacts your neighbor who is struggling to get out of bed each morning. People depend on public and private health care coverage to get help, including the ability to find a mental health provider and access appropriate treatment. But mental illness affects more than just the people experiencing it. It impacts caregivers, including parents, children, and spouses, entire communities, the entire country. While 1 in 5 people experience mental illness, 5 in 5 people are affected by it. On Election Day, there will be many issues at stake. When you're at the ballot box, remember our children, parents, partners, and workers in communities across this country who are all counting on you to vote for mental health. Go to voteformentalhealth.org to learn more.
Thank you.
Right. That's a nice little video. All
Gives
right.
me, when the map comes up, it gives me shivers.
Yes. All right. Well, welcome, Kathryn. You are a retired clinical psychologist, and I guess you've kind of had part-time work with NAMI for a while. Do you want to just explain why you're here representing NAMI today?
Well, it's part of my job, and that title is to raise mental health awareness. And then that's kind of an umbrella term, because underneath it at this time of year, it's about being really wanting to let people know what's at stake when they vote. And so the current concern, which I had shared, before, when I forget what it was that you did, but I was there and I brought it up, and that's how I'm here today. But the governor, and many of you might know this, at one point in the middle, I don't know, April, March, May, June, who knows, said that he was asking all of the state agencies to cut their budgets by 20%. And that was a kind of a off the shoulder kind of thing. It wasn't like a big announcement or anything. It's just that this was something he was going to do. So everybody's done that. And probably a month later, we were told by the Mental Health and Recovery Board of Clark, Greene, and Madison counties, who's our major funder for our staff and the drop-in centers that we run, et cetera, told us to expect 20% cut in our budget. We also knew that they were telling, for instance, the community network, which is Greene County's public mental health center, that they were going to have a 20% decrease. Thinking, about what that would mean for us, we were also thinking about what that would mean for the people that we serve who have mental illness, who go to TCN and they go to mental health services in Clark County, and mental health services provides the services for Madison County. And we know that their budgets have been cut and cut and cut and cut. And there's probably not a whole lot that they couldn't cut that wouldn't really affect those people who depend on them for quality mental health services. So, so what I've learned is that there is a coalition. It's called the Coalition of, I wrote it down because I keep forgetting it. Coalition for Healthy Communities, that NAMI Ohio, which provides training and support for its affiliates like us. NAMI Ohio is part of that. A lot of housing organizations that provide housing for folks with mental illness are involved in that. And they're going to go to the legislature and ask that there be a flat budget for all mental health services in Ohio. So the legislature are the people who make the budget and say, what the budget for, in this case, the Ohio Mental Health and Addiction Services, which is, we call it OMAS. And then they distribute that money out to the mental health boards in each county. And we're a mental health and recovery board. In Montgomery County, it's the Adams board, but they do the same thing. They contract with NAMI CGM for our services. So that is what we have been very concerned about recently in terms of mental health awareness.
Sure. Now tell me, who do you serve? What kind of people do these boards that you just mentioned serve?
Well, they provide funding for mental health services like the community network, but they also provide services for the substance use folks. And so there are many of those in Greene County and in Clark County. BVR is up in, not BVR, but oh, shoot, I'm missing all my letters together. But there are many agencies within Greene County that are able to operate. And what we do is we operate 2 drop-in centers for folks who have mental illness. So these folks tend to have serious and persistent mental illness. They tend to have diagnoses of bipolar disorder, schizophrenia, some who have medication-resistant depression. There are some folks like that, and some people have multiple diagnoses also. So these are folks that, generally speaking, are not able to work, but can reach a certain amount of recovery. And we think that, if they can get up out of bed and get dressed and ready for the bus, or get on their bicycle in Fairborn, some people ride there on their bicycles, that's a big step in the right direction. And and our centers provide socialization, and we give a free warm lunch every day. So that's part of our services. And then the staff that provide supportive services within those centers. We don't do job training or anything like that. We want to have a place where folks can go where they feel safe and respected.
Okay. So these are people that don't have other options. They don't have insurance that can send them to, a psychiatrist or into rehab centers or things like that.
They can run into barriers, but most of our folks qualify for Medicaid. Okay. So the concern there is what will happen at the federal government level, but it can also happen at the state level. Now, we've been very lucky that we've had 2 Republican governors in a row who've been very good about mental health funding. We have lots more we'd like to ask them for, but I mean, basically they have been open to our last governor, Kasich. He made Medicaid for all in Ohio, right? He did it by administrative rule. So that was a big deal, because most of our folks do have Medicaid. They do have access to hospitalization. There can be blips in that, but we step in and help. We can advocate, because another thing that we do is advocate for them within systems of care.
Right. Yeah, because if you have an illness that prevents you from working, I mean, this is a country where, you need money to get health care normally. So yeah, that's a really valuable service, because hopefully they can get the treatment they need and get them stable and in recovery and back into the workforce.
Right. And we still have problems with, some of them are on SSDI or other programs within Social Security. And of course, at the national level, there are threats there. So, when people come to us and are concerned about that, we say, we have to stay in the present. You can write, we give them the opportunity and telephone numbers and stuff. And some people can do that. And some kind of, no, not so much, but in terms of their anxiety about losing that, the thing that, allows them to pay a portion of their rent, or maybe they're staying with family and it's important to them to, give their family some money. I mean, it's a very, right now it is a very anxiety producing environment for
Sure.
who have serious and persistent mental illness. You mentioned to me something earlier when we were talking about the state hospitals. Basically 20, 30 years ago, the state of Ohio decided that it wasn't going to, didn't want to be in the business of hospitalizing people. They didn't want to pay for that. Basically, that's what it came down to. And those, were arguably probably the most expensive hospitals in the state, because that's what it takes to take care of people. Sure. So there still are some hospitals. There aren't enough beds at any given moment. Each mental health board has a number of beds that are theirs. And most of the time, I guess I should mention here, if anybody who's listening, and Kim, this is good for you to know, if you need a bed in a psychiatric hospital because of someone who has failed to get better through hospitalization locally, and sometimes people need 3 months in the hospital, not everybody, but we still have need for that. Sure. And you've not been successful, call us. The Mental Health and Recovery Board, we know who to talk to, and we can get that request into them, and they can almost always find a bed within the state. It may be a long way from that person's family, but right. they can be safe and secure there. It's not ideal, and I wish it wasn't that way, but we work with the system that we've got to make sure that if somebody needs long-term care, they can get it.
Yeah. All right. I will put the links for this information on in after this video for people to access if need be. All right. Yeah. And we were talking before, and we talked about what mental illness looks like, right?
Right.
There's a whole range of what that can look like. Do you want to explain a little bit what can be included in a mental health issue?
Sure. You want to put this one up? The one that has the
yeah. Let me see if I can do that. Okay, here it is.
So I'll just start talking while she's posting this. Basically, 1 in 5 Americans has a mental health condition. That's the big banner on this. And you can see there, this document is telling us how many millions of people have these kind of diagnoses. And the one thing that I will do for you, because there's lots of text here, is I will tell you that most people who get a diagnosis of a mental health condition are diagnosed with anxiety or major depression. That is the largest group here. And if you take a look at the numbers at the top, you'll see that.
Wow.
And what typically our culture thinks of as, well, the good news about that, I should stop and say, is that we have many treatment options for people who have anxiety and depression, and that is a very good thing. So there are people who have anxiety disorders and major depression, and these are serious challenges for people, but with medication, most folks can do what they want to do. They can pursue their dreams in their life, that kind of thing. We think of people with mental illness as that group of down below in that last line, especially where you see schizophrenia. This is where sometimes there can be signs that are visible. Anxiety and depression isn't always real visible to us, but definitely schizophrenia and borderline personality and bipolar disorder. We may see some, by dress or by speech or symptoms of the medication they're on, that kind of thing.
Right.
And that's who we think of as having mental illness, when in fact, there are far more people that have anxiety and depression, where there's good outcome. Usually you have to work with your doctor, find the medication that works for you, because what your friend takes may not work for you. With that caveat, but that's really what this is about. And to emphasize that this is common. This is very common. This is, we don't tend not to talk about it. There's a lot of stigma around having a mental illness still, but those of you who are listening to this will know more than you did before. And if you have an opportunity to share it with someone, great, because that, when we talk about it, that breaks the stigma.
Yes, I agree. All right. Sorry, go on.
If you could put the other one up, then I can talk a little bit about, yes.
This one?
Okay. So this was put together with statistics, some stats from Ohio specifically. So there's about, on the left-hand side or at the top, there's a big number there. And these are the number of adults who have a mental health condition. And the point is this is 5 times the population of Cleveland. So again, it's very common. It's not something, and then the next block says that 50% of mental illness begins by age 14 and 75% by age 24. So the point here is that mental illness is really an illness of youth. Most people are diagnosed when they're still pretty young. And you'll notice that this is also the time when the brain is still developing. We don't really get our full capacity brain-wise until about around the age of 24. So there's some research going on about the plasticity of the brain, and that might account for some of this or that kind of thing. Then there's a little bit of information about how many emergency department visits involve a mental health condition. And then if you drop down to the second line, this is the thing that we need to work on. This slide says only about 4 in 10 people in Ohio with a mental health condition received any treatment in the past year. So we need to work on different constituencies that have different barriers to getting treatment. The African-American community, people of color in general, tend to have poor mental health outcomes because they lack access. The people that provide the treatment don't look like them. That's a barrier. And I could go on, but just take it from me, there are barriers. And then the next slide is about how much it costs us. So if we get better about prevention with schizophrenia, we know that if we get treatment to folks the first time they have a psychotic break, things are much better for them. And TCN has a program that addresses that, which we could feel great about. And just real quickly, because I know we don't have a whole lot of time, we have a shortage. This is a slide on the left at the bottom. There's over 2 million people that live in a mental health professional shortage area. So if we look at Madison County, there are places in Madison County where it's a long drive, and you have to have a car that works, and you have to have money for the gas to get to the psychiatrist. That's really the story there. Right. There also may be that you don't have insurance that covers mental health care adequately or at all. So there are many counties in Ohio that are very rural, and there are maybe 1 or 2 psychiatrists in the county. Maybe they don't have any. So this is a real issue that we need to take a look at. Depression is probably the number one leading cause of disability. That's been a fact for as long as I've been in NAMI. And then we can't leave without saying that suicide is a public health emergency in our country. And all you have to do is look at that slide there. We don't have to spend much time on it because I know we're time limited, but suicide is a public health emergency. And this is Kathryn Hitchcock saying that. Nobody has declared that. But if we were dying by cancer at that rate, or diabetes by that rate, or heart attacks at that rate.
Yeah.
So that's my point. So, right.
Well taken. Yeah.
Okay. Yes.
All right.
So that's mental health 101.
Yes, that's good. All right. So one last question before we wrap up. We started with that video talking about voting for mental health. So how does that work for us? What do we look for when we go into the polling place? If we want to support people, our community, with adequate resources for mental health, what should we do for that?
I think you should be aware of how much knowledge the candidate has about mental health in general, and whether they recognize that no matter what job they have after they're elected, that they will have a constituency where 1 out of 5 people have a mental health condition.
Sure.
Those are the things that right there, that's what that very simply put.
Right. And it's every level of government, right? I mean, the county commissioners have impact, the state reps obviously do, and the Senate, federal, all of it.
All of it. Anybody that is on the ballot at any given time, and it differs for state. Sometimes there's insurance advocates or something like that. I don't think we have that in Ohio, but there was a long list I told you on the Act for Mental Health website about a long list, and some of the people that were on that can get elected I never heard of, but nonetheless, when you get elected to an office, there are going to be 1 in 5 of your constituents that live with a mental health condition, and they have the little video said 5 people at least who love them, and are affected by that. And I will have to say, to just briefly tell my story, my father had bipolar disorder, and my sister has bipolar disorder. It's the one mental illness that has a very consistent, we think it's genetic. It runs in families, and it's the only one where there's a very high correlation. So my sister, I didn't get it, and my baby sister didn't get it, but I have seen the system from all different kind of aspects. And I would never have been telling you this had I not got involved with NAMI. It gave me all during my clinical psychology training. I did not talk about this, what happened in my family. So I had broken through that stigma and dealt with a lot of feelings that I had about, shame and anger and all that kind of stuff. And so I'm glad to be here, because if I hadn't, I wouldn't be here talking to you today.
No, that's fantastic, Kathryn. Good for you. That's really good. All right, well, thank you so much. I guess as an action, we will put up some links where people can get more information that you discussed. Should we be calling our state rep and state senator, asking them for that flat budget? Is that?
Yes, yeah. that was yes, absolutely.
Okay. All right, I can put that up too. All right, well, thank you, Kathryn Hitchcock. I appreciate talking with you today and sharing that information.
You are welcome.
We'll see you around.
All righty.
All right, bye-bye. All right, so let's wrap up today's Front Porch by just talking about what we're going to do next week. I'm excited for next week, actually. I'm going to have representatives from, well, I've got 3 confirmed, hoping for the 4th one to be confirmed, representatives from the 4 cities in District 73, basically who are involved with the grassroots group that have arisen up to combat racism following the death of George Floyd. So we have reps from Fairborn, Beavercreek, Sugar Creek, and hopefully Yellow Springs. So that's going to be a really interesting conversation. I love community organizing and I love fighting racism. So great combo. All right, thank you everyone for tuning in. We'll see you next week. Enjoy your weekend.